This is Sarah Wilkinson from Humber College and the University of Guelph-Humber. In this next set of videos, I'll be looking at factors that affect stroke volume. In this one specifically, I'll be explaining the concept of preload. In previous videos in this series, I've given you the definition of cardiac output, stroke volume, and heart rate, and discussed the regulation of heart rate. In this set, there'll be 3 videos, one looking at preload, the next one contractility, and the following one afterload, which are all factors that affect stroke volume. Recall that stroke volume is the volume of blood ejected from the heart ventricle with each beat. Let's take a closer look at the left ventricle, which I've illustrated here with these simple lines. This left ventricle fills with blood, and we call this end diastolic volume, which is the volume of blood in the ventricle immediately before it contracts. The volume of blood varies. Sometimes it is less full, and sometimes there is more blood in the ventricle. This blood exerts a pressure on the ventricle walls. We refer to this as preload. So preload is the pressure exerted by blood in the ventricle. This pressure will stretch the contractile proteins in cardiac muscle cells. If we have more blood, there'll be a greater pressure, that is, a greater preload. As you can see here, the greater blood volume stretches the ventricle, so that we can say a greater end diastolic volume will result in a greater preload. I've illustrated here the effect of blood volume in the ventricle and the stretch on the contractile proteins within cardiomyocytes. If you're familiar with muscle physiology, you'll know that this is depicting myosin and that these blue dots are depicting actin. In order for skeletal or cardiac muscle to contract, myosin needs to bind to actin and initiate a power stroke. When these myosin cross bridges are stretched out, for example, when there's a greater preload, there's going to be more potential energy stored within them. If you've ever shot a slingshot as a child, you'll know that the greater you pull back on the elastic, the greater you stretch it out, the farther your rock or pebble will fly. The same thing happens in the heart. The greater the stretch on the myosin, the more force it can exert in the subsequent contraction. We refer to this as the frank-starling law, so that a higher end diastolic volume, which results in a greater stretch on the myosin cross bridges, will result in a greater stroke volume due to the force exerted. In contrast, a lower starting end diastolic volume does not result in as much preload, and therefore there is a lower resulting stroke volume. So to summarize what we've just discussed, the end diastolic volume, which is the amount of blood in the ventricle, i.e. its preload, will stretch the myosin cross bridges. This results in potential energy generation in the cross bridges and affects the force of subsequent contraction. The stronger the force of contraction, the greater the amount of blood ejected from the heart, and that we know is stroke volume. So let's add one more factor into this. You'll often heard the term venous return, and this is going to affect the end diastolic volume. So let's take a closer look at what venous return is. Some of you may think when I say venous return, I'm referring to the famous tennis player returning a serve. This is not what I'm referring to. What we're talking about with venous return, it's the volume of blood returning to the heart. So as you know, blood enters the right and left atria through large veins coming from both the systemic circulation as well as from the pulmonary circulation. And the volume of blood returning to the heart is going to directly affect the end diastolic volume, that is the volume in the ventricles immediately before contraction. There are many factors that are going to determine venous return and end diastolic volume, and in this video I'm going to discuss a select few of them. So I'll go through the skeletal muscle pump, the respiratory pump, blood volume changes, gravity and body position, but there are many, many more factors that affect blood returning back to the heart. Let's start off with the skeletal muscle pump. As you know, veins have very low blood pressure. And recall that veins are the large blood vessels that return blood to the heart. Part of the mechanism involved in returning blood to the heart involves skeletal muscles. Skeletal muscles surrounding the veins contract, and this will increase the pressure in the veins. And this will propel blood back towards the heart. If there is more skeletal muscle contraction, there will be a greater venous return. Next, the respiratory pump. Before we move into the respiratory pump, let's take a quick orientation through our abdominal and thoracic cavities. As you know, there is a large skeletal muscle at the base of the lungs called the diaphragm, and I've depicted it here with this black line. Below the diaphragm, we refer to this cavity as the abdominal cavity, and above the diaphragm, cavity is referred to as the thoracic cavity. There is large veins passing between these two cavities. For example, the inferior vena cava, as well as many other thoracic and abdominal veins. Let's take away the structures now and just look at our thoracic and abdominal cavities. Within each of these cavities, there is a different pressure, and changing this pressure will cause blood to flow. When the diaphragm contracts and lowers, there's an increased intra-abdominal pressure and a decreased thoracic pressure. And blood always flows from high pressure to low pressure. So the act of breathing will aid in venous return. And for the exercise physiologists out there, you know that ventilation changes with exercise. Moving on to our third factor that is going to affect venous return, and that is blood volume. There is variety between people in how much blood is in their body. As an example, males often have more blood volume than females due to their larger size. Furthermore, some people have more blood in their bodies due to genetic variations, or for example, endurance athletes have a much higher blood volume. And you can think about that if we have more blood, there's going to be more blood in the ventricle, hence affecting end diastolic volume, resulting in a higher stroke volume. In contrast, losses of blood volume, such as dehydration, will reduce stroke volume. Finally, let's have a quick look at gravity, or body position. So here I've got three different body positions. One head down, the other one supine, and the following one standing up. All of these different body positions are going to result in different venous return to the heart and will affect stroke volume. So to summarize, we've covered 4 factors, although there are many more, that are going to affect venous return. We discussed the skeletal muscle pump, the respiratory pump, blood volume changes, and body position. All of these factors are going to directly affect blood returning back to the heart, which will affect end diastolic volume and consequently result in changes in stroke volume. In the next video, I'm going to discuss the second factor that affects stroke volume, and that is contractility.